Hi, my name is Erin Stratton, and I'm the adjunct faculty member responsible for the Langston-Tulsa Simulation Lab. You're watching or listening to this because your instructor plans to use simulation in your course curriculum this semester. Because your simulation experience is so important to us, your instructor and myself would like for you to be as prepared as possible. First things first, anytime you're scheduled to work in the simulation lab, you need to wear your Langston uniform. In the sim lab, you will most likely be responsible for caring for a patient, so please bring all the items to the lab that you would normally bring with you to your clinical experience. A couple of days before you are scheduled to work in the simulation lab, your instructor will provide you with an outline for the simulation activity. This will include the objectives for your experience. Look closely at these. They frequently will contain information about a patient or disease process that you should expect to be working with. Additionally, you will be expected to perform several skills that you have learned throughout your educational experience. Those skills can be giving medications, oxygen administration, or placement of a Foley catheter. Your outline will also contain a brief summary of the patient and the situation. Langston has invested a tremendous amount of money into their simulation equipment, and because of that, we want to make sure it stays around for a long time. Oils from our skin can easily rub off on the simulators and over time can cause their skin to break down. To prevent this, please wear gloves when working with the simulator. Any ink from papers or even newspaper can rub off onto the simulator's skin. Please leave all papers, ink pens, and pencils at the door. Your instructor will provide you with all the materials that you need in the sim lab. So, you're now outside the simulation lab and you're ready to begin your simulation. You will draw from a couple of name tags the role that you are placed in during the simulation. These roles range from maybe being a family member to the charge nurse to actually being the primary nurse. Your instructor and I will let you know what to expect. If you are a family member, I will give you a few things to say in order to help you cue the primary nurse in their care. If you are the charge nurse, make sure to observe and record activity and vitals so that you have an understanding of what care needs to be given. If you're the primary nurse, your role is to take care of the patient. Follow the physician orders, your MAR, and the Cardex. Remember that you can delegate to a secondary nurse if there is one, and ask your charge nurse for help as well. Immediately before entering the room, you will receive report from either your instructor, myself, or the charge nurse. As soon as you enter the room, your simulation begins. Please remember that you are caring for this patient. Have you ever been to an exercise class where the instructor tells you that you are going to get out of the workout what you actually put into it? Well, simulation is the same thing. If you can absorb yourself into the situation as if it is real life, you will have a better learning experience. Let me show you around the lab a little bit. This is Nursing Ann. She is great for learning about different heart, lung, and bowel sounds. You may be responsible for actually getting her AM vital signs. She's also very willing to help you practice those basic skills. These cabinets are located on the south wall of the simulation lab. There are labels on 4 of the cabinets which contain items such as medications, syringes, IV start kits, dressings, oxygen administration equipment, suction catheters. Everything that you need to complete your simulation will be here in these cabinets. All medications that are administered to the SimMan are distilled water based. This prevents any damage from being done to his internal components. Additionally, SimMan contains software that allows him to determine how much of certain medications he is given. In order to do this, you must use what is called an RFID tag. When drawing up medication, the vial will have a label attached with Velcro to it. Remove this label and apply it to the Velcro on the provided syringe. Your patient's room in the sim lab also has a basic crash cart if needed. This dry erase board is used by the charge nurse to record any information that he or she feels is important or is asked to record. This is the only marker allowed in the room and is not allowed to leave this area. Let me introduce you to our SimMan 3G. He's capable of breathing, has a heartbeat, can cry, moan, sweat, talk, vomit, urinate, bleed, and he can even have a seizure. His pupils constrict and dilate. He has pulses that can be palpated. Just about anything you could imagine, but he can't move on command. This is our SimMan's monitor. As the instructions on the screen say, you will need to touch the screen in order to activate such things as the blood pressure, EKG, and other monitoring capabilities. This is a touch screen monitor, much the same as you will see in the hospital. The pulse ox comes on as soon as it is attached to him. You'll notice there is a phone next to the monitor. We don't want you to feel as though you can't call the physician for orders or get in touch with the lab if you need them to draw some blood. You can even call respiratory therapy if your patient needs a breathing treatment. Just remember, we can't make it so lifelike that there will be a person on the other end of the line. So simply pick up the phone and explain what you need and your request will be granted. Just like your patients in the hospital, your patient in the sim lab will also have a patient chart complete with the physician's orders, a Cardex, and a MAR. Make sure you know where these are located when you come into your patient's room and refer back to the plan of care frequently. I just want to share a little bit about the rest of the equipment in this room. This is the virtual IV. It has several programs that allow you to demonstrate and practice the steps of placing an IV catheter correctly. Please be very careful when using this equipment. The tip of the virtual catheter is very sensitive and therefore very expensive. Please remember that simulation can be used for several purposes, including evaluation of what you have learned, as well as teaching skills and improving critical thinking. Students have expressed in the past that they have found simulation helpful because they can make a mistake here with no consequence to a real-life patient. Another benefit of the simulation experience is the opportunity to reflect back and discuss the simulation with your instructor during the debriefing period. You will learn from what you did right, what went wrong, and what you feel like you could have done better, and how you worked as a group. Please take advantage of these simulation activities. That's all I have for you. If you think of any questions you have, please feel free to ask me or your instructor. I look forward to having you in the lab.